It's affecting my life in the way that I've had to completely change the way I do things. I was very active before. I used to do a lot of running, martial arts. I can't do any of that anymore. So I've had to change my lifestyle to suit what I can do.
With his friends, when they went on holiday, things like that, he became the video man because he couldn't physically do the active things that they were doing. So he found a role for himself that way.
I had limb salvage surgery, so a lot of my right leg is now metal, but my leg is still there. I do have a permanent walking disability, so I walk with a limp. And I've learnt, or had to learn, how to adjust and adapt to the lifestyle changes that having this illness has forced upon me.
I find that I can't do a lot of normal family things that families do. The kids would like me to go out in the garden and kick a football around with them, and I can't do it, which leads to a lot of guilt feelings, a lot of feeling that I'm letting them down. However, as they always remind me, they don't know me any different. They just say, my mummy can't run, but she gives really good hugs.
What it was, I was an operational police officer. Because of my mobility issues, I'm not able to be operational, but actually I've gone on to have a really fulfilling and rewarding career anyway. I was determined that it wasn't going to stop me from fulfilling my ambition of becoming a detective, and it hasn't.
People will generally get better and better for 6 to 12 months and sometimes a bit beyond that after treatment. Their legs will get stronger, the muscles will get stronger, and they'll be able to do more. But after that, most people find they have a certain level of disability. So that means they're not quite as able to do things that they could before. And people who've had treatment for primary bone tumour, the disability aspects, in other words, the not being able to do things quite as well as they could before, is quite an important part of what we call survivorship. In other words, what life is like after treatment.
I personally am still on a lot of pain relief, a lot of painkillers, which make me very tired. I've had to change my entire job, my entire career, so that I can find a job where I'm seated. But I still do it for my own personal well-being. I think to get to work for me is very important because I still keep my own identity, my own personality.
Like I want to live like I would have done before, then you've got to get up, put your leg on and get on with the day, really.